Well, first of all, I think that we've pivoted during COVID to more using remote interpreters more. And so I think that there's an acceptance of remote interpreting and a validation of the value of remote interpreters, where maybe before it was everything was we prefer in person, which actually I find the word in person a little bit offensive because a person on the telephone or a person on video is also in person. They just happen to be remote. So on-site is the word that I prefer, is that they want an on-site interpreter. And I totally understand that and I get that. And there's a real value in having on-site interpreters, especially for your most common languages, because they can act as ambassadors for the hospital. They can expand the role a little bit as long as their language services manager is in agreement on that. But it's also forced many vendors to look to offshore their resources just because, and I'll be frank about this, hospitals don't want to pay. They don't want to pay for, US-based employee benefit eligible interpreters. And it's just very, very difficult to survive as a vendor. And actually, during COVID, we would not have been able to pivot if we had not been able to rely on remote interpreters. So I think also that we need to focus on languages of limited diffusion, and we need to make sure that they get the same training, the same qualifications as all the other interpreters. So I don't think we can just any longer just accept a warm body because they happen to speak the language. I think we need to be creative about making sure that they meet the same standards as every other language, that we make sure that they get quality training, that they do a language assessment, whether it's the English to English, like for CCHI certification, whether we sponsor scholarships or, work in exchange for training, like volunteering so many hours in a free clinic or volunteering so many hours in local hospitals, so that they have the same experience and the same quality that the other languages possess. Well, let me just say that it was a big surprise to be nominated and an honor to be nominated, but to win was like, oh my gosh, it was just one of those huge milestones in my life that I will forever be grateful. Um, the the Language Access Champion Award was based on contributions to the immigrant refugee community, participation and support of immigrant and refugee organizations, also what you contribute to the industry. And so I've trained thousands of interpreters across the US. I started two nonprofits in Central Ohio. One is called the La Clinica Latina, which is at the Ohio State University Medical Center and serves uninsured Spanish-speaking patients. And the other one is Leon, the Latino Empowerment Outreach Network, which was a collaboration of all kinds of community representatives, everything from pastors to principals of schools to bilingual staff. It really was across the board. And the idea was to bring all these people together that all had the same needs and help them to collaborate to build resources for the new immigrant and refugee communities. Also, back in the day, which ages me, if you hung your shingle out and called yourself an interpreter, people just accepted it. There was no language assessment, there was no training requirement, and also hospitals didn't have strong language access programs in place. They had a list of people who spoke a language, and if they would call them, and if they were available and they showed up and the invoice seemed reasonable, they paid it. So there was no quality assurance. There was nothing making sure that they had had training, a language assessment, HIPAA assigned business agreement, that they had done a hand washing, class, how to prevent, the spread of disease and illness and bacteria, professional behavior in the workplace, all those kinds of things. And so I was part of the group that collaborated to bring the first training to Central Ohio. And we worked with different refugee and immigrant organizations. So we had quite a spread of languages. And it really was the beginning of creating a system between hospitals and clinics and agencies and organizations that merited credit for having a structured plan in place, and also that plan supported quality. That's what I can remember, because it was back in 2016. So, but I was nominated by a colleague, and I had no idea why she was asking me all kinds of questions. And then next thing I know, I get a phone call from Erika saying, guess what? You're the 2016 Language Access Award winner. And I was in the middle of an international adoption that had drug on and on and on. And I started crying, and everybody in the office was like, is the adoption done? And I was like, no, but the next best thing is I was nominated for the Language Access Champion Award. It's not that difficult. In the beginning, we came up under the umbrella of other organizations while we got our feet sort of established. We had to apply for an ITIN number. We had to, set ourselves up with the government entities. Then we needed to raise money in order to be able to do what we needed to do. And so we were very fortunate. We had a lot of people with a lot of energy, some time to commit to this. And we held, our first gala sort of event for Leon, and it was a huge success. So with Leon, our focus was education. And so we worked with the leadership of Southwestern City Schools, which is the largest school district and with the highest percentage of refugees and immigrants, to build a program where they had bilingual assistants in the schools. They also provided interpreters for parent-teacher conferences and other kinds of meetings, and really helped them to build a language access plan. And we won an award from the Ohio Department of Education for the work that we did. And then finally, healthcare, we did I guess it was a guide to where to seek healthcare, but also your rights to an interpreter. What is the role of the interpreter? Because sometimes people come to them and say, this is my gas bill, I can't read it. Can you, help me with this? And that's not really their role, right? And, we tried to provide very holistic. And then also, I think a big part of it was the partnerships that were created for different nonprofits and schools and churches and various clinics and organizations to collaborate together to meet their needs. Well, the first thing is that the account managers that manage the accounts, they have to be extremely knowledgeable about language access, because in many hospitals, sadly, they either had a manager for language services or a director, or maybe they never had anyone. And so the person who is managing language services is the person who's also managing patient escort and parking, and doesn't really have a background in language access. And so having account managers or account partners that are extremely knowledgeable about the laws and compliance, and also who've had the privilege of visiting different hospitals and seeing the way things are run different places, and sort of recognizing what are the best practices and being able to share that with leadership so that they can make good choices around their language access plan and their policies and procedures. And of course, every hospital system is different. And even within the hospital system, the individual hospitals are different. You have a 7-bed hospital that's part of a system that also has a large children's hospital and 2 large inpatient, and then something, like half a dozen in between. And so you need to recognize that hospitals each have their own culture, but at the same time, they do need to have consistent resources, and the staff need to consistently understand the importance of language access and how to obtain an interpreter or other auxiliary resources. They need to, have that kind of knowledge right at their fingertips and be retrained and trained and trained, because we all forget. We have turnover. We have traveling nurses that are only in place 6 weeks or 12 weeks. So you have to have a plan to make sure that you're training the staff on a regular basis and being creative about that, whether it's skill days or cultural learning CEU events that you're able to bring in some basic cultural norms, of course, recognizing that all of us are unique and look at our world through our own lens and our own experiences, but being conscious and aware enough to ask the right questions. And I think that that's really at the crux of language access and respect for and dignity for refugees and immigrants. For me, the challenges over the years have been that hospitals want to cut budgets. And so it's very important that someone in a director or a manager role really can speak the language of the C-suite. So it's not about doing the right thing right for the right reasons. It's showing them how they're leaving money on the table by not doing X, Y, and Z. And that in turn provides quality services for patients. The other thing is that getting buy-in, if a hospital, unfortunately, if they've been sued in the past for not providing services, they tend to be much more open and have a much more robust language access program. There seems to be an attitude of, we'll take our chances, and they don't always do the right thing right, or don't always, invest in policies and procedures in a language access plan. And I was very lucky when I was managing language services for Ohio Health. I was able to build the program from the ground up. And about 2 months after I started, risk management brought me this box this thick. And they said, we think you should have this. And it was a letter of concern from the Office of Civil Rights about the 4 hospitals that I managed in Central Ohio. Now, gratefully, when I opened it, I had already taken so many classes and webinars and workshops in Title VI and in civil rights and what were the laws and how to be compliant with them. So I'd already started to accomplish, much of what their recommendations were. And they did send someone from the Chicago office every month for a year. But they do not want to sue you. They just want you to be compliant. And so if you're open to their guidance and their suggestions and everything, because they don't give you a roadmap that tells you exactly what you need to do. You still have a lot of autonomy about what's appropriate for your hospital or your hospital system. But I learned so much, and I learned how to do it right. And I learned how to, implement a language access plan, how to train staff on all the best practices, because of course, this person's visited how many dozens and dozens and dozens of hospital systems. That's their job. And when we finished the year-long coaching, they then used our hospital system as a model for other hospitals. And that was the biggest kudos I could have ever received. And, I think the challenge is making sure that the C-suite understands the value and where money can be left on the table if they're not implementing a language access plan and policies and procedures, and they're not doing the appropriate outreach, whether it be new employee orientation, skill days, workshops, seminars. I also think every single hospital that runs a language access program really needs to do a year summary of all of the work that they've accomplished, because the decision makers need to know how valuable and important this is. And oftentimes language services just sort of slides under the radar. And I think it's really important that we share the good news of what we're doing. We share the accomplishments. We share how we brought compliance, how we've saved money, but we also share where our needs are. I mean, if we don't tell them and we don't make a case for it, how would they know? And that's not a passing conversation. That's a document that shares. And a lot of hospitals turn it into a celebration. They bring in, a cuisine from the different cultures that they serve. They have speakers. They get a champion for language access who's a physician or in nursing leadership to give a presentation. They really go all out. And I think that is a wonderful example of ways that hospitals can celebrate what they're doing well, but also bring to the attention of areas that could be improved. You know what? This was the question that popped out of me as being so important. So, if you're starting out and you want to be an interpreter, almost everybody goes to an agency, right? Because hospitals aren't going to hire you if you don't have any experience. Public health centers aren't going to hire you if you don't have any experience. But interpreters are often so eager to get their first job that they do not read their contract carefully. Many agencies or vendors that use contracted interpreters have a clause that says either A, you can't work for any hospitals that we serve, or B, you can't work for any other agencies. Well, if you're an independent contractor, you would be very short-sighted to sign a contract like that, because most people are looking for a place to land where they're going to have benefits and health insurance and all those kinds of things. And they want a regular schedule, which means that, their goal is to get a job in a hospital system. But if you have an agreement in place that says you can't work for any hospitals that they serve, that's really, cutting you short for what you're able to do. Also, especially if you speak a language of limited diffusion, working for one or two agencies, you will not make enough money to make a living. You have to work for many agencies in order to piece together a living. You also need to understand, are they going to pay you travel time? Are they going to pay you mileage? Do they have a minimum? Because your time is valuable. And if the patient doesn't show up, what happens? You should be paid a minimum. You should be paid the mileage. You did what you committed to do. But these are some of the mistakes that a lot of new interpreters make. The other big mistake they make is a lot of times these vendors or these agencies have their own training, and yet that training does not qualify you for national certification with either NBCMI or CCHI. So if you want a resource that tells you what a good training includes, on the National Council of Interpreting in Healthcare, NCIHC website, there is a document that says sort of what are the components of a really robust language access training program. And you want to make sure that whether you choose to be, because, for most interpreters, they want the professional recognition of being nationally certified. So they need to make sure that they take a training that's going to adequately prepare them for that. And usually you have to work a year. And so you just want to be very careful about what you sign, what you agree to, what kind of training you sign up for, whether it's something that's going to allow you to use it to become nationally certified. There's just so many things to look at. And but you need to protect yourself because you're in business for yourself. That's the bottom line. You are your own business person. You are an independent contractor. This is your business. You need to track your mileage. You need to track every single expense. You need to track, if you have your own office space, if you're doing remote calls, you have to have a door that's locked, so that's HIPAA compliant. You need to be writing all of those things down on, on your taxes. And there's been several excellent workshops offered by organizations like CHIA that tell you, that walk you through what you should do as an independent contractor to get the most out of, what your expenses are versus what you're claiming on your taxes. And I would highly recommend either taking one of those trainings or, for the minimum, at least meeting with your tax consultant. I think the reality is that all vendors are going to pivot to some degree to using offshore interpreters. And I think that being able to just saying, well, we use offshore interpreters and just leaving it at that, to me, that's not enough. You should go on site. You should interview the interpreters and ask them what they're paying, but they're being paid, so you can measure that against a fair wage in that country. Now, we know it's going to be less than the US, but is it a fair wage for that country or that region? What kind of protocols do they have in place for breaks, or if they have a difficult call? To me, there's two kinds of difficult calls. There's the very emotional, fetal demise, someone gets a terminal diagnosis, something like that. That's very disturbing, right? It's something that a lot of times we have to, take a 5-minute break, go wash our face, take a walk around the building, shake it off. But you also should have somebody that they can debrief with. So whether it's a supervisor or a manager, they need to be able to debrief. Are they being afforded adequate break times for like every so many hours? Because when you are interpreting over video, it's not like you're just sitting in front of a camera. You are actually projecting yourself through that camera into that patient's room. And that means your posture, where your eyes go, your eyes are not on the patient necessarily. You might glance down to pick up on the facial cues, body language, but you are focusing on projecting yourself into that room. So you need to be aware. I mean, are you getting breaks? Who do you debrief with when you need to debrief? Is there a limit to how many hours you can work a day? Because we know there's studies out there that said that fatigue affects our ability to interpret accurately and completely. We need to know that the interpreters are being paid a fair wage, that they get adequate breaks, that they have someone to debrief with. Because there's two kinds of difficult calls. There's the fetal demise, terminal diagnosis, et cetera, et cetera. There's also those providers that are rude to you. You're trying your best. You got your professional hat on, you're prepared, you're projecting yourself through the camera, you've got good posture, you're taking notes, you're shredding those notes after every encounter, you're following all the rules, but they're treating you in a way that's not respectful. That's very demeaning to an interpreter. And so, those are the two kinds of most difficult calls. And so you need to have someone that you can talk to about that. And also, what are their quality assurance? Do they listen in? Does the vendor listen in? What are the repercussions if someone is performing poorly as an interpreter? Will they be coached? how many tries do they get? All of that needs to be very transparent. And I think that vendors, it's going to come down to, they're going to pick, or hospitals are going to pick the vendor that can provide the most information that is positive and is in the best interest of the interpreter and of the patient and of the hospital, that's going to make the difference. So if I have vendor A that doesn't have very much information, I've never been on site, I've never interviewed anybody, I know nothing about how they train, I don't have any proof of their training, or you have a vendor that says, here's the file, here's proof of their language assessment, here's proof of their training, this is the training we use, this is how, here's our policies and procedures, here's what we do when, people need an extra break or to debrief. This is the limited number of hours they can work in a day. Those are going to be the agencies the vendors that hospitals are going to start to compare. And they're going to want to know that information, and we need to be able to provide it. And that makes it's an investment. Many times you have to travel to different countries around the world because that's where you're getting your interpreters. But having eyes and feet to the ground tells you a lot more than just having an email conversation or a telephone conversation with someone. I think you really need to see it with your eyes, and you need to be able to make a testimony about that, and in a way that allows your hospital customers to have faith in what you're doing. I hope that everyone will join us for Leo 7 in June. I think the panel has amazing subject matter experts on it. And I think that whether you're a supervisor, a manager, a person in leadership, or even an interpreter, you're going to gain valuable information that's going to help you to be more successful in your career, and also will allow you to plug into the different resources and things that are available to help you along that pathway.